A sweeping federal crackdown is unfolding in California after authorities confirmed an FBI-led raid targeting an alleged hospice fraud scheme tied to Medicare, a case investigators say could involve billions of dollars in improper claims. According to federal sources, the operation has already resulted in hundreds of hospice licenses being revoked, sending shockwaves through the healthcare system and raising urgent questions about how such a massive scheme could operate for years. Officials say the investigation centers on allegations that vulnerable patients were enrolled into hospice care improperly, while providers billed Medicare for services that were unnecessary, exaggerated, or never delivered. The scope of the case, estimated by investigators at up to $7 billion in potential fraud exposure, has stunned healthcare watchdogs and lawmakers alike. Tonight, we break down what federal agencies have confirmed so far, how investigators say the alleged scheme worked, and why this case is being described as one of the most aggressive healthcare fraud crackdowns in U.S. history. This is not just a financial crime story, it's a case that touches patient trust, medical ethics, and taxpayer accountability. According to federal law enforcement officials, the California hospice investigation is the result of years of coordinated work between the FBI, federal healthcare fraud units, and regulatory agencies overseeing Medicare. Agents executed search warrants and enforcement actions across multiple locations, focusing on hospice providers suspected of participating in what investigators describe as a widespread billing fraud scheme. Authorities confirmed that approximately 280 hospice licenses have been revoked or suspended as a result of the probe. Federal sources say the alleged scheme involved enrolling patients into hospice care who did not meet eligibility requirements, then billing Medicare for services that were either unnecessary or not provided at all. Investigators stress that hospice care is intended for patients facing terminal illness, making any abuse of the system particularly serious. Officials describe the allegations as not only financial misconduct, but a profound breach of trust involving some of the most vulnerable patients. The scale of the alleged fraud has drawn national attention. Investigators estimate that improper billing tied to the scheme could reach as much as $7 billion, though they caution that final figures will depend on ongoing audits in court proceedings. The FBI's involvement signals the seriousness of the case, elevating it beyond routine regulatory enforcement into the realm of major federal criminal investigation. Authorities have emphasized that the investigation targets specific providers in individuals, not the hospice industry as a whole. Many legitimate hospice organizations, officials say, provide essential and compassionate end-of-life care. The focus of the probe is on alleged bad actors who exploited the system for profit. As evidence continues to be reviewed, prosecutors are now determining which cases may lead to criminal charges, civil penalties, or permanent exclusion from federal healthcare programs. Officials say the investigation remains active, and additional actions are expected as the review continues. Federal investigators say the alleged hospice fraud scheme relied on systematic manipulation of Medicare's reimbursement structure. According to officials familiar with the case, Medicare's hospice benefit, designed to provide comfort-focused care for patients with terminal diagnoses, was allegedly exploited by providers who enrolled individuals that did not medically qualify. Investigators claim some patients were admitted despite having non-terminal conditions, while others were allegedly kept in hospice far longer than regulations allow. Authorities say documentation played a critical role in the alleged scheme. Investigators are reviewing medical records that reportedly contained copied language, questionable diagnoses, and certifications that did not align with patients' actual conditions. In some cases, federal sources allege physicians were pressured or incentivized to approve hospice eligibility without proper evaluation. Regulators stress that falsifying or exaggerating medical necessity undermines the integrity of the healthcare system and places patients at risk. Another key component of the investigation involves billing practices. Federal officials say Medicare was allegedly charged for services at the highest reimbursement levels, even when care provided did not match those claims. Investigators are examining whether services were billed that were never rendered, duplicated, or inflated beyond what patients received. These practices, if proven, could constitute both civil and criminal violations. The rapid growth of hospice providers in certain regions of California also raised red flags. According to healthcare oversight agencies, the number of licensed hospices expanded far faster than patient demand, prompting audits and reviews. Those audits, officials say, revealed patterns that eventually triggered federal involvement and the coordinated enforcement action now underway. As agencies continue piecing together evidence, authorities caution that the investigation remains ongoing. While enforcement actions have already been taken to protect patients and taxpayer funds, prosecutors say additional findings could broaden the scope of the case in the months ahead. Beyond the financial allegations, investigators say the most troubling aspect of the case is the impact on patients and families. Hospice care is intended to provide dignity, comfort, and support at the end of life. Federal officials argue that when the system is abused, it doesn't just cost taxpayers money, it risks harming vulnerable people during their most fragile moments. Authorities are now reviewing patient files to determine whether individuals were improperly classified, denied appropriate treatment options, or placed into hospice care prematurely. Patient advocates have expressed alarm at the findings emerging from the investigation. They warn that improper hospice enrollment can alter medical decisions, limit access to curative care, and shape how families understand a loved one's prognosis. Regulators say that even when care itself is not overtly harmful, misrepresentation of a patient's condition can have profound emotional and medical consequences. Ethics experts note that healthcare fraud cases involving end-of-life care carry a unique moral weight. Unlike other billing schemes, hospice fraud intersects directly with trust between patients, families, doctors, and the healthcare system. Federal authorities say this breach of trust is one reason the response has been so aggressive, including the mass revocation of licenses to prevent further potential harm. The investigation has also prompted scrutiny of oversight mechanisms. Lawmakers and regulators are asking how so many providers were able to operate under questionable practices before enforcement escalated. Some experts argue that gaps in auditing, delayed reporting, and fragmented regulation created opportunities for abuse that went unchecked for too long. As public awareness grows, officials stress that the case should not discourage families from seeking legitimate hospice care when it is medically appropriate. They emphasize that the vast majority of hospice professionals act ethically and compassionately, and that the goal of the crackdown is to protect both patients and the integrity of care. As the investigation deepens, attention has shifted to the legal and regulatory consequences facing those involved. Federal prosecutors say cases of this magnitude typically result in a combination of criminal charges, civil penalties, and permanent exclusions from federal healthcare programs. Authorities are now reviewing which providers and individuals may face prosecution, in which cases may proceed through civil enforcement under the False Claims Act, a powerful legal tool used to recover taxpayer funds. Regulatory agencies have emphasized that the revocation of 280 hospice licenses was not a symbolic move, but an emergency action designed to immediately halt suspected misconduct. Officials say license revocations are among the strongest measures available and are only used when regulators believe patient safety or program integrity is at serious risk. Providers affected by the action have the right to appeal, but regulators stress that reinstatement requires clear evidence of compliance and reform. The case has also sparked broader policy discussions in Washington. Lawmakers are calling for tighter oversight of hospice licensing, more frequent audits, and stronger safeguards to prevent rapid expansion without adequate review. Some officials argue that the scale of the alleged fraud exposes weaknesses in how Medicare monitors growth sectors of healthcare, particularly when profit incentives are high and oversight lags behind. Healthcare compliance experts say this investigation could reshape enforcement nationwide. Other states are now reviewing hospice operations within their jurisdictions, looking for similar patterns in billing, certification, and patient enrollment. Federal authorities have signaled that California may be just the beginning, warning that providers across the country should expect increased scrutiny moving forward. As the legal process unfolds, regulators stress that accountability is not about punishment alone, it's about restoring trust. Ensuring that hospice care serves its intended purpose, they say, is essential, not only for protecting public funds, but for honoring the dignity of patients at the end of life. As federal investigators continue reviewing evidence, officials emphasize that the California hospice crackdown marks a turning point in how healthcare fraud is identified and addressed. Authorities say the scope of the alleged scheme, both in financial scale and patient impact, required an aggressive response to prevent further abuse. While prosecutions may take months or even years to fully unfold, regulators insist the immediate actions were necessary to protect vulnerable patients and safeguard public funds. Legal experts note that cases involving alleged Medicare fraud of this magnitude often result in long-term consequences beyond the courtroom. Providers found to have violated federal law may face permanent exclusion from Medicare and Medicaid programs, civil recoveries reaching into the billions, and criminal penalties that include prison sentences. Even those not criminally charged could see their professional careers permanently altered through regulatory sanctions. Federal officials have reiterated that all allegations must be proven in court and the due process remains central to the investigation. They caution against misinformation and stress that legitimate hospice providers should not be painted with the same brush as those under scrutiny. The goal, they say, is not to undermine hospice care, but to preserve its integrity. What this case has already made clear is how fragile trust can be when systems designed to care for the dying are exploited. Investigators argue that healthcare fraud at this level does more than drain taxpayer resources. It erodes confidence in institutions meant to provide compassion during life's most vulnerable moments. As the investigation continues, the California hospice case stands as a stark reminder of the importance of oversight, accountability, and ethical responsibility in healthcare. Whether this crackdown leads to sweeping reform or exposes deeper systemic flaws remains to be seen, but its impact will be felt far beyond California.